commonplace. But what Nora's going to talk us about is how to do that at as early as possible within schools. So with that, Nora, please definitely introduce yourself to everybody. And I'm really looking forward to this conversation.
Incredible. Thank you. Hi, everyone at Health Impact. I am so thankful that you're all here because it's an all hands on deck moment for American health. I'm Nora LaTorre. I'm the CEO of Eat Real, which is a leading children's health and planet health nonprofit where we believe that every child deserves a healthy, delicious future on a livable planet. So the reality in America today is that our children are on track to experience 693 fewer sunsets than their parents. In medical terms, that's about almost 2 years of a decline in life expectancy. As a mom of a 3-year-old and a 6-year-old, I find this very unacceptable, which is why I joined Eat Real to do everything I can to restore their life expectancies, restore our children's lifespans, their health spans, and their happiness spans. And all three right now are down, which is why I'm so thankful that you're all here trying to make a greater health impact and accelerate health solutions. So what people don't realize when you look at the biggest driver of this decline in life expectancy that we're witnessing, and life expectancy actually peaked in 2014, 6 years prior to COVID in America. And so what people don't realize is that actually the biggest single driver is poor nutrition, is preventable ultra-processed food and lifestyle diseases. The good news is that means that we can do something about this and we can change the health trajectory for our children and change it really quickly. So I just want to illustrate a little bit about this children's health crisis, because it's not just that they're going to die early or that they're later in life going to have poor health spans. It's actually that they're increasingly sick right now. So I just want to take a second to illustrate this. So I want you all to imagine that you're out at recess and you're holding hands with 5 friends in a circle. You're in a circle. Well, today, 3 of those friends that you're holding hands with are on track to be obese by the time they're 35. In 8 years, 35-year-olds, 3 out of 5 will be obese. Now I want you to think back to the last bath that you had, maybe warm water, candles, maybe bubble bath. I know it's not just for kids, like some warm bubbles, but now I want you to replace that warm water with sugar. So kids in America today eat a whole bathtub of added sugar. Kids eat 65 pounds of added sugar a year, and we think it's actually more than that. Right, I see a lot of heads shaking. Something that like you can't unsee. The next time you see a bathtub, you're gonna feel a little bit sick to your stomach. As a result, we have things like type 2 diabetes up 77% in kids, a preventable ultra-processed food-related disease, since the pandemic in a very short time. Now, remember this morning when you brushed your teeth, hopefully flossed, your dentist would be making your dentist proud. That took about 3 minutes, hopefully. Or when you poured some tea and let it steep in a non-plastic tea bag and in a mug, in a ceramic mug, and let it steep for about 3 minutes. Or the last time TikTok is back, so TikTok, you watch this TikTok video or a YouTube video that took about 3 minutes. Well, every 3 minutes in America today, someone is amputated from diabetes. And as I just mentioned, 77% of kids, that type 2 diabetes is up 77% in youth. So they're on a track to amputation unless we do. That's why this is an all hands on deck moment to restore our children's health, and so that they can be right now on the playground and not headed towards the doctor's office. 6-year-olds are getting Ozempic shots. 6-year-olds should not be having to navigate that right now. And so how do we restore our children's health spans right away and quickly and restore their health trajectories? So if food is the biggest driver of this children's health collapse and American health collapse, what's the biggest food lever? How do we really change our food system to restore children's health? Well, at Eat Real, we believe that the best way to change the health, and the best way to have health impact, since we're at Health Impact Forum, is to change the largest restaurant chain in America and change that menu. Who knows what the largest restaurant chain is in America in unit locations? Subway. Someone said Subway. It's actually Subway. That was awesome. So there are 20,000 Subways in America. But that was a trick question, a trick pop quiz question. Because there's one restaurant chain that feeds kids that's larger than Subway, Starbucks, and McDonald's combined. It's our US public school system. So there are almost 100 public schools in our country, and there's one, if you think about it, in every town, and they serve about 30 to 100% of kids' calories. So our theory of change at Eat Real is if we can change our US school food system and change core calories for kids and make them healthy, nutrient-dense, and nourishing, then we will restore this American health trajectory and restore our children's health quickly. So at Eat Real, we have an award-winning program, which is rapidly scaling, where we actually stand next to local food heroes in schools, communities, and we actually assess their school food system against our rigorous standards. We have 10 key standards, which I have up, and we look at everything across the menu. And we then help them make changes, re-regionalize their food system, take out the bad things, add in the good things, make it delicious, and make it so the kids love it. And then we reassess them so that we can really get a strong data-driven before and after of how we change a food system so that we measurably know we are changing the health and the nutrition of our children. So what does that look like? I'm gonna look clear, happy. Okay, there we go. What does that look like? So you probably remember school food, and I'm from the Midwest. So I was talking to someone from Wisconsin. I'm from Minnesota. It was very beige growing up, and in a lot of places that's still what school food looks like. But on the right is what Eat Real school food looks like. That's actually a picture from one of our menus. It's vibrant. It's delicious. It's something kids want to eat. And so it can be that good. Actually, our school food service directors around the country, the nutrition directors, text me photos of their lunches, and I swear you would have wanted it catered here today. Like, it is so delicious. I always ask them, like, can I get that Uber Eats? Can you deliver that? Can I stop by and invite myself for school lunch all the time? I crave school lunch. It can be that good, and it should be, because we believe that cafeterias are the most important classroom, and they really are the key to unlocking American health. So we're changing the menu in schools. So this is a really exciting example. This is Fresno Unified. They're the third largest district in California, which is the fifth largest economy in the world. It's 70,000 students, 103 schools. They have about 85% free and reduced lunch rate, which is a proxy for poverty. So a high impact community. And this is what I had for lunch there recently. You can see why I crave it. And so that is a Mary's Organic Chicken, which is sold at top restaurants, and no hormones, no antibiotics, etc. And that's a pozole, and the students voted that it needed lime and cabbage. And then that is buffalo. I dream of this salad. It's move over sweet green. It's a buffalo chicken salad with ranch. And as I said, I'm Minnesotan, so we drink ranch, and that ranch has fresh dill and is so delicious. That's diesel organic chicken. That's a chana vegan masala. So scrumptious. And they went from offering one option to their students to 3. And that variety and student choice has driven up participation. So what's exciting is that our schools are seeing that this is a better business model. They can invest in high quality ingredients, and the food gets better, and the students are happier, and the parents are happier. So this is just a concrete example of real health change that's taking place in communities around the country. So when this is another example, in Morgan Hill Unified, we help remove 34 pounds of added sugar per student per year. So this is the food service director, Michael, and he's actually hauling in a wagon into the school board to celebrate achieving Eat Real certified green. And it's a wagon full of sugar. And then he stacked it on the school board's desk. And that was as much sugar as it was as tall as my little guy Nico. So it was like as tall as my 3-year-old. And that's how much sugar he removed per student per year. And that happened quickly. Like, this change can happen really fast, which is so exciting. So I just want to quickly share, what does this mean on a personal level when you transform food and you change a food in a community? So really quickly, Dom is one of the football players, star football players in one of our schools, and he's kind of like a pizza everyday kind of guy. And he was a little late for school lunch, and he walked in, and there was just the organically grown on-site at the actual school, the farm, hydroponic farm, and there was only those salads left. And so the food service director said, just try it. So he tries it, a little reluctantly, but he tried the salad. And that night he rocked his game. And he came back the next day to the food service director and he said, thank you. That was the exact fuel that I needed. And I think I'm a salad guy now. Or another example is actually teacher Allison. So teacher Allison, I was with her in her classroom recently, and she told me that she loves real food in school, and that ever since they started serving real food breakfast, she hasn't heard one "I'm hungry" in 2 years. And she reported to me that her students are focusing better in math. This is actually a picture of Diana, and Diana is a student, and she just was accepted into Stanford, first generation to be accepted into college in her family, and she feels like real food in school helped nourish her to be able to have that academic success that she needed to achieve her dreams, which is so exciting. Like, she is so passionate about real food and how it made her feel so good. Finally, I was talking to Macy recently, and Macy's a mom, and Macy felt like just that we talk about the mental load of parenthood. For any parents in here, I think you know what I'm talking about, all the mental load that you went through this morning. And so she really feels like being able to trust food in school for her family just was one less thing that she had to worry about, and that she didn't have to plan for and shop for. And she was just like just a little bit of relief of that mental load. And as a result, she felt like there was less tension between her husband, and she felt like she could be a more present mom. So for Dom, it helped him rock his athletic dreams. For teacher Allison, she has a more engaged classroom. For Daisy, she's achieving her academic dreams. And for Macy, she is a happier family. This is the power of real food on a very personal level. Real food creates real change for our communities. So just really quickly, so Eat Real in the last 5 years has gone from helping 50 schools to 500. And what took us 5 years, in the next year, in 1 year, we're about to reach 1,000 schools, and we're on track to reach 1 million students this year. So we are rapidly scaling. Right now we're in 10 states, and by the end of this year, we should be in 20. And I think with all of your help, we can definitely be in 20. And so this is a really rapidly scaling movement. Here are some of the numbers. We don't just stop there. We actually work community by community, but we also raise awareness, and we help take our data and roll it into policy. So we then show what's possible, and that communities want change throughout our country. So we just passed the first sugar standard at a state and the national level for the first time in U.S. history. So we showed that we were already doing it in schools and that it was effective, and then it just passed this year. You can all clap for that. You can all clap for that. It's like a big deal. This has never happened. And then most recently, you've probably been hearing about food dyes. So we were actually the Go Get 'em nonprofit that championed that, and that now the FDA so we passed it. Multiple food dyes were banned in the state of California, and the the FDA just banned red food dye number 3. Yeah, that was like a big deal. So in addition to going school by school, there's national change that we can make really quickly as well. And so we're really excited about this multi-pronged approach to transforming our food system and transforming health. So finally, we're a rapidly scaling nonprofit, and we are a nonprofit, which means we're philanthropically funded by our corporate partners, by angel individuals. We have U.S. government funding as well. So if you know anyone that could get involved, a family office, a corporate, I know there's some incredible corporate leaders here in the healthcare space. If you want a really high impact, very vetted cause that makes real change and is taking off, we'd love to have you involved. We're really picky, but who we partner with, but we'd love to have a conversation with you so that we can really create local change in the lives of your employees, families, and across our nation. So finally, in closing, and I know Megan and I are going to have a conversation in a second, but finally, in closing, as you're looking out at the sunset over the New York City skyline tonight, right before everyone's connecting, I know everyone's connecting later, but as you're looking out at the sunset tonight, I want you to think about how can we give our kids more sunsets in their lives? How can you accelerate solutions like Eat Real? How can we all create health impact faster together? Thank you. Okay, and then here's a QR code. If you want to scan this, it goes directly to my inbox and it says, I want to join the Eat Real movement. This is a movement and it's going to take all of us. As I said, this is an all hands on deck moment. And so it would be incredible if you reach out, share your superpowers, connect us to philanthropic opportunities, and get involved. We would love it. And it's truly people like you that are making this happen. And you can also find me on LinkedIn. I'm on social media. So I would love to just continue this conversation and keep connected. Thank you.
Thanks so much, Nora. Yeah, I met Nora actually on LinkedIn, as met many of you over the years, and inspired by her group and the work that they're doing. Tomorrow we have a session on food as medicine, but I had one question because I know it is sort of an interesting time in America's healthcare system, and you guys are doing a lot of work. What do you see in terms of that moment right now? Like, what are the opportunities, both from some of us on the public sector, policy folks, as well as on the hospital for what we can do?
Yeah, I think it's a really powerful moment in that this is becoming personal for everyone. And we see people really frustrated with healthcare. And it's not that they're frustrated with healthcare. I think they're frustrated with health. People don't just want healthcare, they want to feel healthy. I think there's a time we're coming out of a pandemic. We want to pandemic proof ourselves from the future. People are having their family members and their kids getting sicker and sicker. And we all have these stories. And so I think it's super personal and people are very motivated because of that. And so I think it's a powerful moment where there's been a shift in our country and there's consumer demand and individual demand for health solutions that quickly work. And so I think there's definitely been a cultural change that's been happening, and we're really excited about it, that people do want to individually understand so much more about their health, right? Personalized, I have my Oura ring on. I've done the, like function tests. We're all like so curious and can have more personalized data on our health. And I kind of think an individual fight to be healthier. We want to take our health into our hands and then work with our providers as well to be healthy. So I think it's a really positive moment in America where we can take ownership and take control of our health in a way and make change fast.
Yeah, absolutely. Well, thank you so much for everything that you're doing.